Good morning. This small conference is organized by Vision plus Onlus, part of Rotary, and today we speak about prevention. Keeping an eye on kiddies' eyes, prevention in childhood, prevention for children. The concept of preventive medicine is an old concept. It dates back to old Greece. And health is unparalleled asset and difficult to recover once you lose it, especially related to eyes. To perform corrective medicine in the right way, and in order for it to be effective, we should know in depth etiology, physiopathological problems of the disease. We analyze. An aphorism says, you can't improvise to become a preventive physician in the field of the eye. The fundamental principle of preventive medicine is aimed at identifying early pathological conditions, and this is important, pathological conditions that can lead to blindness or severe impairment of vision. It's a question of early diagnosis. We do not prevent eye diseases. We're not able to prevent eye diseases. We prevent vision disability and possible blindness connected to eye diseases. And what's the consequence of it? Fundamental element, prevention in ophthalmology is a medical action, because in children we should perform eye examination. Today's session is focused on not just medical problems, but especially social problems. We should give the floor to Dr. Aceta, that shall speak about ophthalmologic prevention in childhood. Dr. Giacotti will speak about the role of associations. Dr. Percali, the role of banking foundations. Dr. Bazia will speak about the role of humanitarian associations, Rotary, and Dr. Galera, the role of public health. I'd like to give the floor to Dr. Aceta.
Sì. Grazie a tutti.
Yes, thank you so much, everyone. Welcome. I am Sebastiana Aceta, eye doctor and secretary of Vision Plus Onlus. We shall speak about ophthalmological prevention in childhood. Why? Because the aim is to identify and remove early any organic refractive anomaly, just like cataract or motor anomalies, strabismus, that can interfere with the development of vision. When it is of crucial importance. So the period in which you can intervene to correct all the defects is from 1 to 6 years of age, maximum 10 years of age. And however, from the 1st to the 6th year of life, it is the best moment to act. This prevention is aimed at asymptomatic population to identify possible alteration of the vision through the tests that can be applied. Alterations in vision today involve 4-6% of children. Now, let's speak about amblyopia. It's a common anomaly. The famous lazy eye, a reduction in visual acuity, usually one-sided, caused by an obstacle to normal sensory development, and it has its onset in the critical period I talked about before. The causes can be organic causes, sensory deprivation due to obstacles that prevent sensory stimulus from reaching the retina, or functional causes, for example, anisometropia, primitive strabismus, secondary strabismus. The aim is to identify the presence of amblyopia and identify possible causes to perform rehabilitation, prevention in childhood. The slides don't go on. It doesn't go on. I don't get the right slides. So let's see the various steps. At birth, the neonatologist plays a fundamental role because he collects the first data and performs first inspection. Family history, severe congenital diseases, strabismus, prematurity, infections, perinatal problems, traumas, causes of possible alterations. If the pediatrician identifies such anomalies, he sends the child to the eye doctor, and such children at risk. Preterm low birth weight, familiarity for congenital cataract, anomalies just like ophthalmus. This is typical ophthalmus. Such children are sent and referred to the eye doctor, and the eye doctor can diagnose congenital cataract, congenital glaucoma, chorioretinopathies due to the torch complex, and so on and so forth. The role of the pediatrician doesn't end here, because red reflex test is performed. It's a single test with a direct ophthalmoscope. You examine the pupil of the child, and if red is uniform, everything is okay. If it is anomalous, you have opacity that prevents transmission of light, or you can have whitish reflex, leukocoria, you can have retinoblastoma, retina detachment, and this test is very important for us, and we worked a lot on this test, because in the past it was not compulsory. Now it's compulsory all over Italy as Vision Plus. We performed a study on 6,000 children born in Mangiagalli in a year. We submitted the results to the region, and a procedure was started whereby the test is compulsory all over Italy, and this was a big achievement in my opinion. So the pediatrician can examine the reflexes, specular reflexes of the cornea. If they are symmetrical, the child is okay. If there is an asymmetry of reflexes, you may have strabismus, a defect in eye motility, and then stereopsis test 24-36 months, and you see if the two eyes work well, or if one eye sees and the other one doesn't see. So by 1 year of age, the eye doctor can diagnose late congenital glaucoma, eye alterations in dysmetabolism, and tumors, early strabismus. 3 years of age, the eye visit should be given to all children. And not all children undergo an eye visit. There is not a culture for it because people believe it's too early, and instead it's fundamental. At 3 years of age, you can define eye motility. You can perform objective refraction, for example, angular vision acuity, and analyze the anterior posterior segment, but very few children receive such a test. And or at least a screening should be mandatory in kindergarten. Red reflex test, you can perform it, it's so fast. Objective refraction and eye motility. In this period, it's specifically what we are doing. We have selected some schools and we are performing screening from 3 to 4, 5 years of age. And we shall disclose the results of the screening once it's over. Thank you so much for your attention.
Grazie mille Sebastiano.
Thank you, Sebastiano. So, waiting for Franco Giacozzi to reach the podium, I'd like to point out that recently news were published in the press. Well, according to this news, 70% of people under 18 years of age have visual problems due to the use of smartphones. Well, I'd like to say that not only are smartphones that cause visual problems are in the young people. Young people are not aware of these visual disorders, visual problems that are exacerbated by the use of mobile phones. Our association performed some screening tests at different universities in Castellanza, Ulm, Liuc, and the Cattolica University. We screened about 3,000 young people aged 18 to 23, and so we saw that more than 70% of these young adults had visual problems without being aware of them. The second piece of news that was published in the press and that confirms our studies, well, is that 70% of Italian people do not undergo any preventive eye examinations, and this is really fundamental. We have been saying this for more than 20 or 30 years. 40 years ago, together with MD Miscontini, I was a member of the association that decided to introduce eye examinations in Milan for all the children in schools. Well, this eye examination has been now abolished completely in the city of Milan. It has been replaced by neurosensorial screenings by the pediatricians. In 1989, I was member of the regional commission that made this decision. Many pediatricians do these screenings, others do not. But, well, these children, babies, should be screened from the 75th day to the 3rd year of age. And now the role of the association, charity association. Why that? Voluntary associations. Good morning. Well, I will then focus on a specific project. However, I'd like to point out the role of voluntary associations that do not want to replace public institutions in the field of screening and monitoring initiatives, as Accetta said. But in many cases, we have to necessarily step in when the public health authority is not able to fulfill all the requests. Voluntary associations, as you know, Italy is at the cutting edge in the field of voluntary work. In Italy, we have the highest number of voluntary associations, not only in the field of healthcare, but also sports association and so on and so forth. However, numbers. The numbers we're talking about are really impressive from different perspectives. In Italy, there are more than 350,000 voluntary associations with more than 5 million active people, according to our calculations, in some cases even 6 million. And more than 300,000 are employees working for these associations. And many of these associations reach impressive turnovers. Well, this is the issue of NGOs and associations, which is a hot topic nowadays. What's happening? There's something going wrong with the presentation, unfortunately. Okay, so what is the difference? Well, first of all, today it's our birthday. Rotary International was established on the 23rd of February 1905. The Rotary Association is the biggest association worldwide for voluntary work and services, and it's a pleasure to talk about this today. For those who don't know what Rotary is, well, it is an international structure that was established originally in the United States. Now it has 500 districts, 35,000 clubs in the various districts, 1.2 million members, and for this reason, the Rotary International is the biggest association for voluntary work and services. And then there are partner associations that gather members together based on their interests, passions, skills and competencies. Well, there may be bikers, for example, or as in this case, well, these members met in 2005 and established the NGO Vision Plus. Vision Plus is a non-governmental organization with many different skills, with Accetta Spinelli and many other medical doctors who are active in providing different services. And by services, we mean preventive services, but also international projects. For many years, we have been active, for example, in Madagascar with surgeries. This year, for example, we will be back to Madagascar to provide surgery free of charge to patients there. And resources are raised through members, through the foundations or companies that support us, as we will see later. So what is the role of associations and organizations? Organizations support these projects and initiatives. I always use this slide to explain how Rotary works. So the big wheel is the international organization, and the smaller wheels are the individual services, so the individual skills, and the intermediate wheel is the club. Or we may say, well, it's the other way around. Well, that's the most famous sketch. Well, you see the gear moving the smaller wheel, which is the project. So associations and organizations usually meet, but they should avoid trying to pursue their interests only, because this goes to the detriment of the projects. So to set up a system, well, I don't like the word system very much, but this is a good way to explain how Rotary and the collaboration with the different organizations can lead to many projects, like the project EYES we are talking about today. And this is how to network and how to set up a system. The circles are the districts, Rotary districts. Or we may also interpret this drawing by saying that every single dot, every single house is the interest of the civil society to focus on specific topics. And this is the basics this is the basic principle of our project. So based on experiences, interests, competences and knowledge, the project EYES was established. And it's a great pleasure for me to talk about this project today because it's Rotary's birthday, as I said, and because I'm a very particular case. I suffer from amblyopia. I have a lazy eye. My parents became aware of this when I was 8 and not when I was 3, as it is usually the case. I have a younger cousin. He was also monitored as soon as my parents discovered that I had amblyopia. And my cousin used this device, and when he became 10, he could see perfectly. Well, the fact of having this so-called lazy eyes led to posture problems, for example. Well, the previous speaker did not talk about this, but besides eye problems, eye issues, amblyopia, in my case, for example, caused also some posture problems because I used to look at things with a certain angle. And also driving and many other activities have always been influenced by amblyopia. And this is the reason why I'm a member of the board of Vision Plus, because I've got great interest for this disease, but I'm also an expert in the field of road safety. And hence I'm very keen on the issues and topics that my visual deficit caused when driving. So the fact that I could not see from my left eye very well, made my father or my driving coach very frightened because they were afraid I could not see the cars when turning left. Well, you know, in the past, the mirrors were not split into two parts, and so there was that blind angle that hampered you from seeing any cars coming from a specific angle. These are the typical problems that all drivers have. So, due to perspective, when you drive, as you have amblyopia, well, it becomes much more dangerous when you drive, and this is the reason why these projects have focused exactly on these issues. Vision Plus aims not only at performing those screening projects among children, as presented before, but we also have projects underway for screening initiatives in the field of road safety, because this is an issue many drivers are not aware of. Many drivers may not be aware of accommodation disorders and many other conditions. And so we have to focus on that, and Vision Plus aims at pursuing these initiatives in the short run. These are the next initiatives, the publication of results, and so far the initiatives put in place in 2017 led to impressive results. Professor Spinelli did not mention that, but during the screening project we made in universities, we found a young adult with a specific disease, and we were able to rescue his eyes. Well, this was a case, an exception, but we could literally rescue his eye. So he was a well-prepared and well-educated young adult, but he never underwent that screening. And thanks to Vision Plus initiative, we were really able to rescue the eye of a young student at the University Cattolica. Well, I've put this picture because last year a fun situation happened to me. Well, holding the same speech last year, I said I was very keen on tennis, and all of my friends are convinced that I play tennis very badly because I cannot see from the left eye. But I can't play tennis at all. And when I was telling my audience about this last year, a lady started to laugh, and I couldn't understand why. So when my presentation was over, I asked her why she was laughing, and she said, I also have a lazy eye, but I was in the French national club, tennis club, so I cannot use this excuse any longer. Thank you very much, Franco.
At this point, an announcement. Short ago, I received communication. The councillor apologizes but cannot attend. I cannot tell you why, but I should say he did care. I met him some days ago, and we said we would meet here at 11, and for sure the problem must be a serious one. Now I'd like to give the floor to Carlo Porcari, board member of UBI Banca Popolare, and he was also president of Banca Popolare Commercio Industria, and he shall speak about the role of foundations. Why do we have here foundations? You have the floor. Thank you so much, Professor Spinelli, and thanks a lot to Mido for having me here today. And before cutting to the chase, I'd like to specify something. In the title, it speaks about the role of banking foundations, Fondazione UBI. And Fondazione UBI, it is a brief definition. You don't have UBI foundation, but have 5 corporate foundations. Let's put it like this. Fondazione UBI Banca Popolare Commercio Industria, Fondazione UBI Banca Popolare di Bergamo, Fondazione UBI Banco di Brescia, Fondazione UBI Credito Bresciano, and for Varese, Fondazione UBI for Varese. It's 2 banks previously joined together, Credito Varesino and Banca Popolare di Varese. So there's no direct reference to Varese, but to the city of Varese. And after this premise, during my speech, I shall speak about the role of such foundations. Why 5 foundations in a single banking group today? As you've seen, I was general manager and then CEO of the Banca Popolare Commercio Industria. I was not president, but vice president. So the bank where I worked always showed attention to social problems. In the course of years, I worked as a consultant for many listed companies, and in my various capacities, I dealt with institutional philanthropy. I believe in individual responsibility to the common benefit, and I'm committed in FI and Dynamo camp for children with diseases set up by the actor Paul Newman. Through extraordinary activities, Banca Popolare Commercio Industria became part of the UBI Banca Group. In 2015, they set up the foundation to keep, in the course of time, the name of the bank. That's the logic of the 5 foundations, and that have disappeared with their individual names, but they set up the group. And so UBI Banca Commercio Industria Foundation and Banca Popolare di Bergamo, Banco di Brescia, Credito Bresciano, and Credito Varesino, and so on and so forth. So the 5 foundations intervene in the various territories of the pre-existing banks and operate in full autonomy based on the guidelines defined by the parent company every year. Fondazione UBI Banca Popolare Commercio Industria is part of Onlus associations, and it started its activity in the first 3-month period of 2017. The board of directors of this foundation I'm a member of examined various projects, approving those that contained programs, especially to the benefit of the youth. And the main aim is to invest in projects that improve the world and the society we live in. I agree on the definition of philanthropy of the Kellogg American Foundation as a donation of time, economic resources and competencies to the benefit of the common good. Giuseppe Guzzetti, president of the Caripo Foundation, recently defined banking foundations as an antidote to the welfare crisis. In the reference territory, banking foundations work together with the voluntary sector and volunteers, and they try and meet social needs expressed by communities and by the country. The project I'm speaking about today follows this direction. As a Rotary member, I got to know through my dear friend Camerino, I got to know the project called Precious Eyes in collaboration with the Vice President, and the project wants to perform screening for 400 children, preschool age from 3 to 4 years, a group of 5 Milan schools. Poor resources in public health and along with poor attention by parents to the problems of the eye of children are at the basis of our project. The aim of childhood eye screening is to identify diseases interfering with vision and reduce the percentage of permanent visual deficits in adult population. And this project is of great importance. And I shared this project with the president of the foundation, and I submitted it to the board of directors October 2018. The board appreciated its content and approved a fund. The title of this seminar, Keeping an Eye on Kiddies' Eyes, is so important, and the eyes are the eyes of children, and we adults have the responsibility to create the conditions whereby kiddies' eyes can express their full potential, and they deserve care because they look ahead to the future. Thank you so much. Thank you so much. And now, before opening the debate, I'd like to give the floor to Roberto Bosia, District Governor of Rotary Club 24-1 for the 2020-2021 period, and he shall speak about the role of humanitarian organizations. I don't have much to add to what my colleagues have just said. They said what Rotary is. We're present in Milan as a metropolitan district. We have a big opportunity to establish a dialogue with public organizations and to carry out specific activities. And we act in 3 big areas: health, the environment, and education. In the field of health, together with the various partner associations, we have developed this initiative. And last year, when we had our district conference, in Vittorio Emanuele, there were desks with health screenings. It's an association of volunteers, professionals, physicians, lawyers, and our aim is to support citizens and to provide them with opportunities. And I hope, from a general perspective, that citizens may be involved, fully involved, to give visibility and 1.2 million of us are present all over the world. We have a foundation financing tens of millions of dollars for various initiatives, and we have the involvement of various clubs and professionals for this initiative. It's volunteers, and they strongly believe in it. And I go back to what was said before. The role of sponsorship is fundamental for our organizations. In terms of content, it's a wonderful initiative. I remember the desks with screening opportunity, and people are demanding prevention. It's one of the important aspects mentioned by Professor Spinelli. And at the center of everything, we should have human beings. Thank you so much. And through.
Prima di sentire se c'è qualche domanda, vorrei...
Thank you very much. Before opening up the discussion, I'd like to spend a couple of words on our association and what it does. As I said, we were set up in 2005. We have just 2 eye surgeons, Accetta and myself. All the other members are entrepreneurs and practitioners coming from other fields who, however, cooperate and much better at organizing things than eye surgeons who are in charge of the scientific part. We have a board of directors. We have to report to the board of directors every year. We receive 5 per mil. So contributions, and our accounts are audited by a board of statutory auditors. We have a scientific committee with very renowned eye surgeons from Lombardy, and who tell us what the projects are, and the projects that we propose are varied, both from a clinical and a scientific perspective. There are 2 associations. One in the law. There are 2 objectives. So one is prevention, and the other one are projects. So whenever prevention is requested through our equipment, our orthotists and eye doctors, we are able to perform complete eye examinations. We have 2 major sponsors, which are Esselunga. Every year in the Sight Month, which is October, we organize in 3 stores of Esselunga in Milan and 2 Esselunga outlets in Florence. We organize preventive examinations. We examine about 120, 150 people per day. The second major sponsor is the Prada Group. We performed preventive examinations in the offices in Arezzo, and next month these eye examinations will be extended to the whole personnel in Milan and in the surrounding provinces. Apart from that, we also have some social projects in Madagascar. There is a small hospital owned by another NGO, and we are in charge of all the eye examinations. So we opened up last year a lab, an optical lab that where an optician works. Many visits are performed on a yearly basis, and we also opened a new eye surgery department per session. And well, sessions are about 2 to 4 per year based on the availability of doctors. Well, about 200 people undergo surgery. The whole equipment is high quality equipment. All the materials used are high quality materials. What we do in Milan is also done in Madagascar. I'm sorry, let me switch off my phone. So again, the same materials that we use in Milan are also used in Madagascar. This being said, let me spend a couple of words on the project that was mentioned before, which is the eye screening for children aged 3 years when they come to the kindergarten. About 600 children will be screened. This is an official project. It is not just a screening initiative that Vision Plus simply supports and performs, because this is a project under the auspices of the Rotary Association that also supported us financially. We have to report to them exactly how we spend their money, and we also have to inform them about the exact number of visits and the outcomes. On the other hand, we have the UBI Foundation that provides us with most of what we need to perform screenings, and we also have to report to them both financially and from a results perspective. Once this official screening is performed, data will be sent to the councillorship, and we talked about this with the health councillor already. Well, we are very small. I don't know if we will manage to be successful, but as we were also part in the initiative on red eyes, we will also continue to work so that a regional law is passed for children at kindergartens, so that they undergo a complete eye examinations, as it was the case until a couple of years ago for the children, or a group of children in Milan that went to school in Via Clericetti. So this is a project involving many different parties. We have politicians on the one hand. Without politicians, we cannot achieve a lot. And then we have technicians, practitioners, and also citizens. Not only are practitioners paramount, but also citizens have to be involved, mothers, fathers, and children, in order to complete the project. Well, a fully fledged prevention program will also go to the benefit of treatment, so we can also help rescuing vision for many people. At Esselunga, in the past, when about 90 people were screened during one single morning, 5 of them were urgently referred to a hospital because of severe retinal problems, 1 or 2 retinal detachment, and those people were absolutely not aware of this problem. So you can realize how important the eye examination is. Let me now conclude prior to starting a Q&A session with an aphorism that I mentioned a couple of years ago, but which is still valid. So preventing superfluous blindness is a human right. I don't know if you have any questions. Please. Yes? There is a question. Hello. I'd like to have some details about children screenings and eye examinations. That is, how are these screenings performed? What are exactly the examinations offered to children? And how are they executed? In a playful manner. I just would like to have a bit, some more details on this project, Occhi Preziosi. Yes, I can answer your question. The screening, because these children undergo screenings that we cannot say these are eye examinations. They are totally non-invasive screenings, and no liquids or substances are used to dilate the pupil. Eye motility is screened. The bilateral refraction is tested with a special device, which is a pediatric autorefractometer. It is a very quick test, which is also extremely reliable. And then the red reflex is assessed, as we explained earlier, and this provides us with important information on a variety of conditions. So the red reflex rules out a series of diseases like cataract, for example. The eye motility can assess whether eyes move well, the absence of strabism, the central position of the eyes, and the autorefractometry tells us about any visual defect among children. And this is very important because you have to make sure that eye defects are the same in both eyes, because this is the real issue. When there are differences between both eyes, children may suffer from amblyopia because one eye does not work and gets amblyopia. There's no chance to correct this condition at a later stage. So if a child has eyes which are not in a central position, we can correct that. And crooked eyes, we can correct this, but this does not hold true for amblyopia. Let me also add what I said in the beginning. Those performing this type of screening must know what they're looking for. So I have a senior orthoptist and eye doctors who know very well how to use these devices. And we also have a portable slit lamp, usually when senior doctors are in charge of the screenings. But in case of doubts, the child is referred to a second level structure where fundus test with pupil dilation is also performed. Have we answered your question? Yes. Are there any other questions? No, if this is not the case, so the session is over. Thank you very much. We are on time, and thank you to Mido for giving us this opportunity.